Fall has begun and the colder temperatures will soon be here if they're not already starting to show their faces. Does this mean we will see a spike in cases of COVID-19 here in Niagara? To discuss that possibility and more, we welcome Dr. Mustafa Hirji to the program. Dr. Hirji, we will be spending more time inside in the cooler months.
Yeah, we will. I assume most people don't like to spend a lot of time outdoors in the cold, and you're absolutely right. It started to get a bit colder just at the end of last week, I think. We all know that fall, winter, that's the time when people get colds. That's the time when people have gotten the flu. And unfortunately, we've seen, 2 years in a row. In December, January, we went into a lockdown over COVID-19 because this is also the season where COVID-19 is at its worst. And so really recommend everybody go out and get a booster dose of the vaccine right now this fall. You've got that new booster dose. It better protects against Omicron variant. And I ask everybody also to re-up your vigilance around wearing masks. So if you've taken a bit of a break over the summer months, now's the time when the risk is going up, but it makes sense to start wearing those masks more.
It's interesting to me. I had some cold symptoms about a week and a half ago, and first thing I did was do a home test, and it turned out negative. Did another one a couple of days later, still negative. But it's interesting to me that for 2.5 years, we really didn't experience cold symptoms. And now, as we are not wearing masks, as we are getting out in public, we are susceptible to colds as well.
Part of what happened over the last couple of years is that everything we're doing to stop the spread of COVID-19, wearing masks, keeping distance, reducing our time out in crowded spaces, that all slowed the spread of COVID-19. It also slowed the spread of everything else. And because everything else doesn't spread as efficiently as COVID-19, they basically went to zero. We saw very little influenza. We saw very little colds and other things. COVID-19, which is the strongest of those viruses, was able to keep spreading. Obviously, we're not doing much of those protections anymore right now. And so therefore, flu is going to probably come back. Definitely colds are coming back. We're going to start to see all those viruses again. And I think what you did was a really good strategy to have some rapid tests that you can pick up at a pharmacy or grocery store and have them around. So when you get sick, you test yourself out, test yourself again a couple of days later, and so you can know if it's COVID-19 or something else.
Dr. Hirji, through the summer, we've seen people participate in some activities where there might have been thousands of people around them. As these activities move indoors, do you think some of these concert halls, sporting, events, arenas, places like that, should they start requiring masks?
I would certainly recommend that. I think as we have those big events indoors, if virus starts to spread, it can spread through a lot of people. Early on in the pandemic, people might have remembered there was a mega church in South Korea, which led to this massive outbreak. In South Korea, we're talking thousands of people ultimately got sick from it. And that's certainly a possibility here. I think the good thing for us is that over 90% of adults have 2 doses of vaccine. So there's going to be some baseline level of protection, but it's not perfect. And especially over time, that protection has waned. And so that's why I think it makes sense to have those masks in those spaces. We can enjoy all of those events while wearing masks still, and just be happy, of course, that we're back to being able to enjoy those events and have sporting leagues operating normally again.
We're now 3 weeks into the return of students into schools. Have we seen an increase in COVID-19 cases amongst that population?
Unfortunately, we don't know because testing is now so limited, at least the PCR testing that we would hear about here in public health. So we're not sure if children are getting sick with COVID-19 or not. We are hearing anecdotally, some parents are saying that they're seeing a fair number of kids out of school sick. We don't know what that could be. That could be COVID-19. It could be one of those other cold viruses right now. So we're not really sure what's happening. What I can say, though, is that there is absolutely risk that infection can spread and COVID-19 can spread. And I think the best thing children should be doing is making sure that they've got their vaccines, and secondarily, to wear masks while in school.
Dr. Hirji, you mentioned the vaccine. Right now, without public health clinics for the vaccine, how does one go about getting the booster shot?
Yeah, so there's fortunately a few different options for that. The place where actually is delivering the most vaccines right now are pharmacies. We have over 100 pharmacies in Niagara giving the vaccine, so just check on your local pharmacy and hopefully they'll be giving it. Second, you can come to one of our public health clinics where, for example, at the Canada One Outlet Mall all this week doing vaccinations, and we'll have that new vaccine, as well as vaccines for kids and others who might need it. So that's the second option. And the third option is to check with your primary care provider. There are a few primary care providers offering that vaccine. And the last thing I'll just note is that once in a while, we have the GoVax bus, bus that has vaccine clinics in it. I was just here in Lincoln yesterday. It's periodically coming up to Niagara. So if you happen to see that in your neighborhood, that's another great option.
There's been a lot of push to eliminate the ArriveCan app for people coming back into Canada, and that looks like that will fall by the wayside at the end of this month. There's also rumors that the Prime Minister will relax vaccination or vaccine mandates, I guess I should say, at the end of this month as well. Are these good moves? Are these risky moves?
Yeah, they're certainly not the moves I would recommend. As we started off talking, I think this is going to be a season where unfortunately we see a lot more COVID-19 virus spreading. And I think it's the exact opposite time that when we're seeing the risk starting to go up, that you're going to back off on some of the protections that you have. I'm also very mindful we've seen lots of new variants emerge, and testing at the border was one way we could figure out what variants are perhaps coming into the country. And so I certainly think that those were measures that I would like to keep. I know lots of frustration around the ArriveCan app, and is maybe there a better way that we could be collecting that information rather than through the ArriveCan app? But I certainly would recommend the government would hold those measures in place for a little longer.
You talk about variants, and it's been a while since we've seen a new variant of concern like Omicron. Do you expect with the winter months that something like this will emerge?
It's a bit of debatable, what is a variant versus what is a subvariant of the Omicron virus. We've seen, a few different subvariants of Omicron, the most recent one being BA.5. And some would argue that this is really a new variant. It's not really a subvariant. So arguably, we have seen some new variants. What I think drives when variants arrive is that when infection is spreading a lot, every time it spreads, it gets an opportunity to mutate. And so the more it spreads, the more it mutates, and it eventually comes up with a mutation that gives it some sort of benefit. Either it's more severe, it spreads more easily, it's more resistant to the vaccine, what have you. And, I think we've seen most countries around the world step back from COVID-19 protections and are allowing the virus to spread more. So I think that's created the opportunity that at any moment we could see a new variant emerge. Perhaps it's a little bit higher in the fall, but even I think without the fall, we are in an environment where new variants potentially could emerge. And I think that really speaks to why we should do some things to adapt our society long term to make sure we're protected from the virus. Key amongst those, I think, improving the ventilation, filtration systems in all of our public spaces. So whatever the variant is spreading, we don't need to worry because the air in our spaces is going to be safe and not spreading the virus to us.
Dr. Hirji, thank you for joining us today. It's always great to hear your expertise. Thanks again.